Good afternoon. And today we have a pleasure of interviewing Dr. Joseph Gaudio. He's an author of Parent's Guide to Healthy Child. I really like to interview authors on my channel. So good afternoon, doctor.
Good afternoon, Maria. Thank you for having me.
And again, thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can spread the word about the great work we're trying to do here. If you medical professional, please use this channel as a networking ground, because only together we can uncover every missing piece of that silent killer of the present time called sleep and breathing disorder and find better solutions for our patients. But the main goal of this channel is to create community of like-minded professionals, medical professionals and patients, because I believe if we bounce ideas off each other, then we can really find the solution. And now I want to introduce you my guest. I'm very impressed. We met recently on Dr. Barry Raphael course by Roger Price. I interviewed them both on my channel. And Dr. Gaudio, he is a dentist who practiced for more than 30 years.
40 this year.
40 years, right. So he's seen a lot, as well as we call it continuing education junkie, but he took a lot of continuing education courses and I put them on a screen. But the most important thing, that we have a similar background. We both graduated from Dawson Academy. We both got the puzzle with a question about the jaw joint pain and grinding and what to do about that. And then kind of it's a parallel in our life, we become interested in sleep and breathing disorders, which I think a natural course of action, as well as orthodontics. And now Dr. Gaudio study more or delve deeper into that area in Dr. Raphael in his practice. He graduated from Columbia University, and he got multiple awards of excellence, of course, and he's practicing in Chester, New Jersey. But the most important part, he's ever learning students and trying to find a lot of answers, what we are very curious about. And, I put a lot of, courses, what he took, but now Dr. Gaudio is teaching his courses, and we're going to find out more about that. So I'm going to ask you my first question, and it's based on that question, what I constantly puzzled about, why people grind their teeth. But that specific question is going to come a little bit later. I would like to ask you, if people come with a pain in a jaw joint, what usually happened in your office?
So once again, I love your mission and thank you so much for what you're doing for the profession. I think what people need to understand is that there's two types of pain that people will present with, acute or chronic. If it's an acute problem, we want to address that with, usually I'll do a Medrol dose pack if someone has taken a fall, which we'll refer to as a macro trauma. Or if it's a chronic issue, that can be related to micro traumas, and that can be related to even the way someone swallows if we have an aberrant swallow. So the trauma can be very long-standing. The trauma could be something that people don't relate to a direct hit to the jaw. It could be a body blow, whiplash, concussion, etc. But with acute problems, we want to do the best we can to get them out of pain as quickly as possible. So we want to decompress the jaw joints if possible. Normally, we'll use an aqualizer if there's trauma to the joints directly from a fall or from a hit or anything along those lines, a Medrol dose pack to reduce the inflammation, and then ice, very light stretching exercises, and even working a lot with allied health professionals. There's some physical therapists that I work with, one in particular, Carol Cote. There's a Paula Fabi who's up in Connecticut. These people are amazing and add so much value to what we do. And so some light exercises and light stretching can be very helpful. When it's a chronic problem, we really need to know whether or not it's an intracapsular problem where there's damage to the components, the parts that make up this joint capsule, or if it's an extracapsular problem where there's really no damage done to the components or the parts inside the capsule, but it's more of an occlusal muscular conflict. So occlusion can be a reason for it. And also, related to the primary function of the body is getting our next breath. So that can be part of this as well.
I would like to ask you, a lot of dentists, I had a course on occlusion in NYU, but then I was also the student constantly about that topic. A lot of dentists get confused. What's the difference in a treatment between intracapsular disorder and extracapsular disorder? And I know you talk about Aqualizer. I just want to make it clear for our audience. It's a soft pack, what somebody put on a teeth, and it let joint decompress or relax. But in a lot of
I'm sorry, go ahead. So that's a little bit more posterior as opposed to a deprogrammer. So when doing an orthopedic examination, if we can load test the joint and there's no pain, then that tells me that it's probably occlusal muscle. The first thing that I'll try to relieve pain, shut down those muscles by up to 90%, is a deprogrammer. An NTI, which I don't care for, because if patients disappear with a very small NTI, other things can happen because it's such an isolated area. We prefer, as you recall from the Dawson Academy, a B-splint, which has the same effect, but we cover the teeth so that there's no chance of individual teeth movement and or mobility that may come of it. If we have a deprogrammer to shut down those muscles, just getting rid of that tension immediately will help to resolve some of those issues. And a lot of referred pain that may come from trigger points that we get set up in terms of the spasms or the fatigue that sets up in muscles. Okay, a lot of that can be related to posture as well. But an intracapsular problem, we want to be able to decompress the jaw joint by going a little further back. Usually premolar areas would be ideal. And that's the kindest way to immediately decompress those jaw joints. And those can be very diagnostic for me as well. I'll always tell a patient, if I give you a deprogrammer, this should be your new best friend. But if it makes things worse, discontinue immediately and call me. Sometimes we don't know from just an examination alone or even three-dimensional imaging. If I can't relieve somebody's pain within 2 to 4 weeks maximum, now I'm starting to think about an MRI because I need to know what's going on with the soft tissue. So again, some of it is not always cut and dry, and some of it can be a little bit more confusing, but we need to stay on that path to find out what's the root cause. We don't just want to put Band-Aids on.
Absolutely. That's very fascinating, because a lot of dentists, at least in my surrounding, when I go to the conferences and we design the design of the guard, they get really confused. What should they use? Ferrar, which is like anterior deprogrammer. But you said it's very clear. It's for extracapsular situation when it's a muscles and you want to relieve them. And if it's inside the joint, you want to use the flat splint to give opportunity even for the back teeth to have a support, I would say, disocclude and have a support, and that's relieve the situation inside the joint. And I guess the jaw can find the most favorable position, supported, what disc can go back in place, the ligament can heal, and, joint can become, in a better healthy state.
Most important point to that is just free up the lower jaw. A lot of times because of the crowding that occurs, which again is a symptom of airway. If we're not developing a mid-face because of all these soft tissue dysfunction that's occurring, then we are trapped. That lower jaw is trapped inside the upper jaw. And so again, a night guard, we used to make night guards with an anterior ramp, that because we always thought centric relation has to be where we need to drive the jaw. Well, now we know from one of the, papers that are out in terms of the literature that sometimes that can make sleep issues worse for patients. We don't want to drive the jaw in any particular direction. A flat plane splint with equal contact all the way around, very kind decompression, but allows that lower joint to go wherever it wants. And I'll tell patients all the time, we're looking for the happy place here first. After we get this, then phase two could be, now we got to coordinate the teeth with the jaw joints.
That's a fantastic thing what you said. Now, I want to ask you, in our previous conversation, you mentioned what you use the laser, and you use a very special laser to relieve the pain in the jaw joint. Of course, we know we don't want people to be in pain. We don't want degenerative joint disease started. We want to create the joint healthy situation as fast as possible. So please educate us about this magical laser you use.
Yeah, I've had a Photona light worker now for probably going on 6 or 7 years now. And most recently, I also purchased one of their X-Pulse lasers as well, also by Photona. And included in that, there's the beauty of that is there's two lasers in a box. It's an ND YAG and an erbium laser. So when it comes to what we can do with it for all of dentistry, it's incredibly versatile because we can use it for hard tissue, soft tissue, etc. When it comes to the ND YAG and what we call photobiomodulation or biostimulation, the beauty of that is that it basically reduces inflammation and speeds up healing. And so we want to use that when it comes to the inflammation in the jaw joint. And one of the things that, again, we learned with occlusion, at the Dawson Academy or whatever philosophy it is, Spear, Dawson, Coyce, whatever it is, I love doing equilibrations in terms of being ultra conservative. However, knowing what I know now, I never use that as my first line of defense. That's the last thing we want to do. The teeth are the last thing that we have in our solution. First, we need to do the jaw joints and make sure that they're in a happy place. And by the way, in terms of having harmony, if we don't have harmony between the teeth and the joints, and we don't have harmony between the joints and the neck, good luck. Because it's, very difficult for patients who come in and say, I've got pain here, doc, can you turn it off? And if the body is not in harmony, and that includes the rest of the posture. So again, there's a lot of evidence out there with regards to how all of this is related. We know if we tell a patient, look up and tap your teeth together, look down, look sideways, your occlusion will change based on head position. Well, you know what? A head forward posture is the same thing as looking up. Your jaw will change that relationship. Even inflammation in the jaw joints will change the relationship of that condyle and how those components are coming together. Last thing we want to do is equilibrate immediately. So once we've reduced inflammation and have had proper orthotic splint therapy for a good 12 to maybe 15 weeks, now that we've relieved all the inflammation, now we can then go to phase two and put the teeth in harmony with the jaw joints. A lot of times that'll require orthodontics. If the teeth are very close together, then there's nothing like doing an equilibration to really fine-tune that occlusion and get rid of any interferences. So one of the things I love, but now it's one of the last steps I take when treating jaw joints. So the lasers are phenomenal when it comes to that inflammation and when it comes to trigger points inside the muscles. So a proper examination should be an orthopedic exam, range of motion, and muscle palpation. And once we know where all these components are that we need to address when they come in addition to using the laser on the TMJ, I use the laser on trigger points as well. And a lot of that has taken the place of injections in terms of nerve blocks. So, big difference.
But this is fantastic. Thank you very much. You made it very clear about treatment of TMJ. And now I'm going to ask you about the part what actually, set up the whole interview. I came across this brochure on a course. And I think it's such a fascinating piece of information. It's so simple. People don't like to read much. So I want you to talk about the brochure, of course, what inspired you. And then I want us to go over pages. So please tell me what inspired you to do the brochure. And,
Well, just like with occlusion, when you first bring this stuff back to the office, people look at you like you have three heads. So to really help parents understand what we're talking about, because everybody said the same thing to me initially when I was trying to get people informed and educated about what was going on potentially with their kids. And so they always asked, why did my pediatrician not say anything about this? Why did my primary care, et cetera, et cetera? And so, I don't ever want to tell someone there's something wrong with your child. I would rather say with this pictorial, the guide to say, okay, here's a checklist. Is there anything here that you recognize in your child that may be telling us that there's something else going on? And so trying to put this all together, I had a lot of passion for this once I got started down this road. And again, being able to do a visual assessment of someone walking in the door and understanding how all these different components correlate, with a retruded chin, with a Malin-Patty score that, I like to look in that throat. I like to see what socks they're wearing. If all we see is tongue and palate, we know that they're more at risk. So to be able to have parents look at something that is a quick read, but gives them a lot of information. And this is something that we always want to do, is we want to do co-diagnosis or co-discovery. We never want to tell people they need this or that. It's kind of a turnoff. So to have them able to understand this vicious cycle that may go on with their children and how we got to where we got to, really opened up a lot of eyes. So very proud of what we did with this and being able to simplify it and not tell someone, hey, there's something wrong with your child. Everybody's child's perfect. Everybody's child's beautiful. We never want to say there's something wrong with your child. But this is an easy way to be able to communicate what we're concerned about when we talk about these credentials of what a compromised airway does to the body over time.
No, this is, that brochure for me, it's like a gold, total gold in a very simple way. And I really appreciate what you took time and you put it together. And I want to let our audience know what additional to the brochure, doctors can have a book. It consists of parts of that brochure.
We did this mostly so that we could basically have this in anybody's office. The pamphlet that came out of it, my bio was here, and this can be personalized for your own office. We also made a trifold so that we can hand this out just to introduce the topic and not to, my wife has a saying, please don't vomit this stuff all over everybody. And this is something that, Barry shared with me as well. When I started working with Barry, he was accused of this as well. But what we wanted to do is make sure that there was a hard copy that we could have in the reception area for patients to look at while we were with their children, and then be able to give them a little information so that we're not overwhelming them. And then to be able to have something that once I do a workup for a case, I like to give them a portfolio that we can have them take with them and or email to them, so that if we're working with other professionals, ENTs, physical therapists, craniosacral, you name it, I want to be able to share that information, share that data. So it's a pretty thorough process, and it's something that became, quite the passion, and I'm very proud of it.
No, I'm very proud of it also. And for people who are interested, I want to mention about Dr. Gaudio great courses. He has a course like about the brochure, what we just discussed, and it says what a child face can tell you about the airway. And also he has another 2 courses about the occlusion, treating TMJ, chronic pain in the nervous system, which is very connected. And another one, what we start talking about in the beginning, of the interview, eliminating occlusion confusion and systematic approach to treating occlusion problems. That's, related to TMJ and sleep and breathing together. So thank you very much, doctor. I think, you incredible source of information, at least for me. I learned so much. And you made it very clear. And I hope our audience can find you through your website and signed up, for professionals, signed up to your course and also have it very clear. Thank you very much for your time.
You're very kind. I really appreciate it. And I'm honored to help spread this word. I love your mission. So keep up the good work. And I'm delighted that we came together.